So, sadly, we had another Albany County resident pass away. My condolences and prayers go to the family and to the other 128 families that lost loved ones through these difficult times. So that brings us up to 129 people that have lost loved ones during this COVID-19. And we all know how difficult it was in the beginning. It's a little bit easier now to say goodbye versus in the beginning. But again, our condolences and prayers go out to the family. As of now, we have 2,383 positive cases of the coronavirus in Albany County. 369 people under mandatory quarantine. So today's increase is 21 positive cases since yesterday. Among the new positives, we know 7 are healthcare workers. 9 have close contact to positive cases. 2 have reported traveling, and 3 don't have a clear source of infection as of yet. 8,238 people have completed quarantine. 2,341 tested positive for the virus have recovered, and that's an increase of 6. There are now 6 people hospitalized with a hospitalization rate of 0.25% of those who have tested positive. Yesterday's rate was at 0.21%. 1 currently in the ICU, and the number was 1 yesterday too, so it stays the same. Over the last 5 days, there's been an average of 8.8 new positive cases each day. Yesterday, it was 6.8, so it went up a little bit. And again, to have 21, we had 20 back after the Hudson Avenue party. That's when we had the increase. And like I said, this is like a roller coaster. When we're up, we're down, we're up, we're down. And again, we can get through this with everyone working together in a partnership. You know, today marks the 5th month since we announced our first case 154 days ago. It's been a long 5 months for everyone, for the essential workers that had to continue to come to work, for the people that had to stay home, to reimagining the workspace, to doing our mission, you know, and figuring out how we're going to continue the services that we provide day in, day out for the residents of Albany County. Our first case we announced was March 12th, and I can't believe 5 months have flown by, but it probably feels like 5 years for a lot of people because we've been pretty much at work 7 days a week around the clock. Since the coronavirus started here in the United States, January 31st was, you know, the news conference on the new coronavirus, and then February 2nd entered the ban on those who had been to China started. And then, you know, unfortunately, we had our first COVID-19 death in the country happen a few days later, February 6th. And as we're going back on our calendar, you know, yes, it's been 5 months since the first press conference, but we've been well into this for 6 to 7 months with briefings started early on, and we kind of forgot about it with everything moving forward. You tend to forget what happened the month before, or the conference calls we started getting on through NISAC and County Executives of America and NACO and the White House and everyone else who started briefing us on all this. We had to re-engage our contingency operations to look at how we're going to operate, and I said that from the beginning. I separated my staff into 3 places on day 2. I recommended to all companies to do the same thing for continuity of services, and going forward, if God forbid someone got sick, we still have to operate. So, you know, our first positive case here in New York State obviously was March 1st, and we had our first 2 cases on March 12th. So it kind of took off from there, from that weekend when we talked about it, and then we got briefings on that Sunday, and then from Sunday to Thursday we started down this road. But I do want to say this. Thank you to all the workers that rolled up their sleeves and worked with us on this, to all the mayors and supervisors that we worked with to get through this, relying on one another, and to the other county executives that I dealt with across the state to get through this, that we continued to talk, and we still talk today on a variety of things, how we can continue to move forward. But unfortunately, after that day, it was just 2 days later that New York would have its first 2 COVID deaths. Why numbers continue to go up. You know, we lost our first Albany County resident March 28th, and unfortunately, like I said earlier, we have lost 128 prior to that. So there's 129 people that have passed away. And then we started looking at our numbers, you know, because this is the $1 million question I get all the time: where we're at today versus where we're at yesterday. How did it affect people? I'm not a doctor. I want to make that clear. We get our guidance from CDC. We get it from the state. We have to interpret it. Dr. Whalen and I go back and forth all the time with our departments, trying to figure out what the guidance is, what they're putting out, and you try to dissect what they're giving us, and we try to put it out from there. Sometimes it's a clear message. Sometimes it's not so clear. But when we looked at our highest day since it started 5 months ago, we had 94 positive cases on April 3rd. Or 30th, excuse me. April 30th was our highest day. While the numbers have been much lower, we've only had one day when we didn't have a single positive case, and that was June 23rd. Our hospitalizations are much better, obviously, than it was in the beginning. April 30th, at our peak, we had 34 people in the hospital, 10 in the ICU. On May 22nd, there was 27 people in the hospital, 1 in the ICU. On June 22nd, there were 7 people in the hospital, 1 in the ICU. And on July 23rd, there were 6 people in the hospital, 1 in the ICU. And again, our numbers continue to get better than it was in the beginning. I identified early on some of the biggest source of people infected but didn't have signs and symptoms was June 20th. Was the age group 20 to 39 or 29-year-old group of kids that were out there in the community that had no signs and symptoms that continue to pass the virus on. As of today, Albany County has 489 total kids in that age group between 20 and 29. And again, most of them don't even know they're spreading the virus, or they have signs and symptoms, and that's what we have to keep identifying and having that group. And younger group people go out. If you saw in Rensselaer County, I think they had some as young as 18 and 16 that have it now. So these are things that I don't want to worry parents, but with school reopening up, it'd be smart to get your kids tested and get yourself tested, get a baseline of where you're at, get the antibodies test done, and then you'll know going forward. One of the things, and I know Dr. Whalen will probably talk a little bit more about this on, is the tracers. Look, they have a job to do. If someone calls you, no, they shouldn't be asking for your social security card or your bank accounts. That's some of the phone calls we got. That's a scam. All they're doing and calling you for is not for your insurance or anything, is where you're at, who you had contact with. Please answer them. I mean, they're just trying to do the job, and it helps the health department, it helps our office continue to map and trace this, which I got to say, Dr. Whalen's team has done a phenomenal job on this. The best in the state, and I believe, and I wish state DOH would take our guidance on tracing and mapping, because we've done a really good job. And it's the same thing with the mobile testing sites. We can only help a community if we know how it's affecting a community. But again, please, if someone's asking you any personal information like that, or your driver's license or that, then it's not a legit person from the Department of Health, or that might be hired through the state of New York. So don't answer them questions. But please do pick up and be honest. I know some people don't want to tell, I had contact with this person, or the person says, don't say I was with you. It doesn't help our cause, and I can assure you, Dr. Whalen in my office, we're not calling the police department to have you locked up. That's not the case. It just helps us stop the spread and to identify it quicker, to isolate it, to stop people from going out that might have had that exposure. So again, please, and continue to do with, the governor continues to preach and do a great job, the fact of going out and getting tested. So please, it is important. I know you're not sick. I'm glad you're not feeling sick. I'm glad you don't have signs or symptoms, but UAlbany's free. Doesn't cost you anything. It's a 5-minute trip to drive through there. They do an awesome job. They always have from the beginning. That number is 1-888-364-3065. And then again, our mobile testing site with Whitney Young's partnership. Please, by all means, call that number, 518-465-4771. And if you don't have insurance or can't pay, don't worry about it. We're paying for it. So the state's giving it to you, a test for free. The county's going to make it. We've made it free. Continue to make it free. Please, by all means, go out and get tested. You got Rite Aid still going on in Colony. You just got to go on the Rite Aid site. And Purdy 1 in Gilliland, 518-867-8040. And again, we'll get through this. Just 4 basic things. Wear your mask properly, cough into your arm, clean your hands, and stay 6 feet apart, and we'll get through it. So as we continue to talk to business owners, small business owners, and we're reopening, and the million-dollar question on top of all the other questions I'm getting when I'm out or via Facebook or email is daycare. And it's an issue that needs to be addressed. It's a huge issue because a lot of workers that are coming back need daycare. And a lot of daycares aren't up and running. The limited of case or camps like the YMCA has done in other places, very limited, and a lot of parents couldn't get their kids into it. A, because it was a smaller group, or B, they just didn't know about it, or C, they just didn't want to send their kids because they don't feel safe, and they're worried. And I get it as a parent, I really do. But, as we have these difficult times going forward, we need to support our small businesses, and we need to help someone in the infant care business. That's the name of your business. You've been there for 15 years. But, I just want to say this. One of the businesses that have been struggling and able to remain open in daycare is on Quayle Street. And Dimitri's done a good job in the community. She's been there over 15 years. And she's a licensed to care for children from 6 weeks old to 12-year-olds. I've been to her place on Quayle Street in First. It's a beautiful building, and she does an awesome job, her and her staff. So I do want to say that. But they were lucky enough to get a lifeline from the CEG. They got a grant for payroll, and after that, she got the news that she was hearing about her PPE loan. So I don't know how that went, but. The daycare is licensed for over 60 children, but only has 15 to 20. Think about that. For 60 and 50 and 20. And when you're operating in a business, and I don't want to take away, just like a bar or restaurant, you have a full capacity, and a lot of times you need it at that number to pay your bills, to pay for your staff, to pay for the quality care parents are getting. And when you can only operate at a smaller rate, but you still have the same bills, and the heat bill didn't go down, the cable bill didn't go down, the insurance didn't go down, liability didn't go down, workers' comp didn't go down. It makes it tough to continue to stay in business and do what she loves, because obviously she's been doing it for 15 years, so you love what you're doing.
I love it.
And, but I'm going to let you talk about it. So please, Dimitri, take over and talk about your experience with your daycare and what your struggles are today.
Okay. Thank you for having me, to you and your staff. Again, it's been my passion working with children, and I wanted to make a difference in the community where I was born and raised. So Infinite Care was born. We are licensed for 67 children, and on any given day, you'd see about 50 to 60 in the building at one time, going in and out of the doors, and just very lively. And to have this come and take our numbers down to about a quarter of what we normally see was devastating for us. But I understood how important it was for us to remain open so that those parents could feel safe and understand that their children would be well taken care of, because they were, in fact, essential workers as well. So it was up to me to kind of dig around and figure out, like, okay, how do I still make this work? So hit the ground running. Let's look out. There are grants rolling around. There are different opportunities, reinventing how I'm providing care. How do we ensure the safety of the children and the safety of the staff, and applying for whatever came across the board. And again, fortunately, like you said, we were able to secure a grant to help with payroll just in time to bridge the acceptance for the PPL grant, which I was able to keep all of my staff on board full-time, even with us working at a quarter of capacity for the last 2.5 months. So it's been amazing for us. Ups and downs, definitely, but I wouldn't change it for the world. Many lifelines out there. You just have to remember the passion and your reason for doing things and just go for it.
It's amazing how you're still smiling through all this, because I find it hard after 5 months. It's been a long 5 months, but for being a small business owner, and some of the complaints that I hear back is, how did you find out about the CEG or the PPP loan? Did you know about it? Did someone help you with it? Or were you just looking so much to survive that you were just going on the internet and just trying?
I think it was a combination of both. I'm pretty tied in with a few people in the community, so I did receive a few phone calls where they're like, "Hey, did you know about this?" or "Why don't you try this?" And it was a matter of going through them and saying, "Hey, do I qualify for this?" And no never scared me. So whether I feel that I'll qualify or not, I'll try it. Hey, no, okay, that's just a detour. I'll find another route. And then there were some things that specifically I found on my own as well.
Did you find it hard to fill out all the paperwork and everything like that? Was it overwhelmingly tough, or?
Initially, it was overwhelming, and then I just got to the point where it's like, you know what? Let's make these phone calls. Most of them leave numbers where they say, "Hey, if you have questions," I pick up the phone and I ask the questions.
Yeah.
So, if you're willing to do the work, they're definitely out there.
No, I'm glad to hear that, because the biggest, one of the problems I had when I talked to small business owners is that a lot of them didn't know how to do the CEG grants or don't know who to apply to. And as government officials, we need to do a better job getting that out to the small businesses to let them know there's grants available. And the other issue is that, unfortunately, the Fortune 500 companies sucked up all the bigger grants, and I've gone over that before. And because they have the tentacles, they have the attorneys, they have the accountants, they know when stuff's
Grant
coming
writers.
out. And for you to be a small business owner for 15 years, be smiling like you are through all this, says a lot about your character, but most importantly, what small businesses are going through. And I'm glad to hear the fact that you did find all this stuff, and you were fortunate enough to be able to fill out all this information, because it is tough for a lot of businesses. And sometimes you have a business owner that you have a barrier with the English language, or doesn't understand all the stuff that's out there. And that's some of the business owners I talked to that after the riots that got wiped out didn't have insurance. Didn't have insurance on the product. So everything that was sold out of that place came out of their profits or pockets. Wow. And when you're struggling and you're trying to reinvent yourself, and especially in your field, it says a lot. And hopefully you'll be around like Quail Auto next to you for the next 75 years, another great family-owned business,
right,
all in the neighborhood over there that's been a fabric of that community. So thank you. Would you like to add anything? Or?
Again, I just want to say thank you for having me, and thank you to everyone that supported us over the last 15 years. We can't do it without the community, so I say thank you to them as well.
Well, no, I'm glad that you're on, and I'm glad that you can talk from that point of view, because I think it's important. The thing I keep stressing is that you are the backbone of our community, and I feel that the small businesses have been treated differently than the bigger businesses, and fairly held to a different standard. And I will be addressing that in a few days, and it's coming. But again, thank you for what you're doing, and thank you for keeping that awesome smile going, because it's making me smile when I want to cry right now. But Dr. Whalen.
Thank you, County Executive, and thank you, Ms. Fullard, for your presentation and for your commitment. It's so obvious in your remarks that you have really taken the time to learn about how to best protect the kids that you care for, and to give families a much-needed sense of security. It reminds me that there's a giant learning curve that's occurred with COVID, and many of us have had to jump into that learning curve and learn how to do things differently. And when I see evidence of someone who has embraced this so fully and utilizes these guidelines and makes this work, it is inspirational, I think, to me personally, and I think to the rest of the business community, I hope, as well. So we continue to monitor our cases. Yesterday's number was a little bit bigger than we've seen in a couple of days, so we'll be following that along. We have no community identified clusters at this point that we're following, but we do have some nursing home cases that we're following, and we continue to move forward with planning with the school districts around getting ready to open up. I know this continues to be a source of anxiety and concern for a lot of parents. I have a sister who is an Albany City school teacher, so she fills me in on that as well, and I understand her concerns and the concerns of a lot of the teachers. you know, it's none of us, unfortunately, as I said the last time, are living in a risk-free environment. But it really is about embracing that learning curve and figuring out how we can embrace these strategies that will provide the best controls. And we have to take reassurances where we can get them. The conversation about school opening nationwide is a little bit different than it is for schools in New York State, particularly in places like Georgia, where we see over 10% positivity rate in the communities. None of the schools, well, many of the schools that are opening in the rest of the country would not meet criteria for New York State. We are, you know, hovering around the 1% and below 1% positivity rate in Albany County. As we continue to follow that, we will be better informed. Of course, this is going to be a dynamic process. Of course, we are going to have to be very vigilant. Of course, there's going to have to be a lot of ongoing communication back and forth. But the reassurance is that, you know, the county health department will be investigating every single case. And as part of that case investigation, we really do employ these very active strategies which occur immediately upon the reporting of the case to ensure that transmission is stopped. And how we have done this in the past couple of months, I think, is a good message to the public. We have been able to stem control of, you know, a couple of different situations that occurred in either daycares or occurred in a school district. And because we made sure that the case was excluded, that contacts were quarantined, and that contacts were tested, we were able to throw out that net and make sure that there weren't others at risk. And I think that this is going to be a good model going forward for the year. So, you know, we have throughout the entire time from our first case been able to do that individual case investigation. And that's not always the case. In some of the counties downstate that got tens of thousands of cases, it simply wasn't feasible or possible. We in Albany County have been able to do that, and we continue to have that commitment to the community that we will investigate every single case and take appropriate action.
Thank you, Dr. Whalen. And just to give you a little update, I know the governor put it out yesterday, there's now 31 states that you must be quarantined when you come back for 24 hours. And Hawaii, South Dakota, Virgin Islands have been added to that list. So just to let you know, I have gotten questions on Canada. Yes, if you do get in here, you have to quarantine for 14 days. I know that's a question they keep bringing up about the border shutting down. I was talking to the county manager in Clinton County and how it's affecting their economy up there because the borders are closed. And I was talking to Mark Bolencourt about the same thing in Erie County. But Alaska, New Mexico, Ohio, Rhode Island, and Washington State are now off the list. And you can find a complete list on New York Forward. I recommend you go to that if you're planning on traveling. I know families are still going on vacations. Listen, the virus isn't done with us. I get it. You want to go away, please pick a place that is not on the list, and you don't have to worry about quarantine. You don't have to worry about going there because a lot of them are having you quarantined for 14 days, or if you go to a hotel, they're telling you can't go out. So I don't know what you're going to do if you go there, but that, you know, again, we're in this together. We'll get through this together, working together in a partnership. So please do the right thing, and we'll continue to keep our hospitalization rate down low and start to open up more and more each day. If people need mental health support, please, 7 days a week now from 8 a.m. to 5 p.m. Area code 518-269-6634. I know more and more people are getting anxiety. They're going to their doctors and they're getting stuff for their anxiety and stuff like that. Listen, please talk to the mental health providers first, and you know, and figure if you can get through this without medication. I know, again, it's difficult, and I see that numbers going up from pharmacists that I talk to. You know, I'm not a pharmacist either, so I'm not going to sit here and talk about every pill that they're talking about for anxiety and everything else going forward that they're seeing. Them numbers go up high. and they're going up high because more and more people are trying to adapt to the new world and are struggling with it. So even though someone looks like they're not struggling with it, they could be. So please be patient with people. And like I said before, if someone's not wearing their mask correctly and you say something, if they don't want to wear it, just stay away from 6 feet and walk away, because it's not worth the argument. It's not worth the debate. People are dug in on their feelings on this. So again, it's not worth arguing with someone over a mask. Also, our 24-hour sexual assault hotline number, 518-447-7716. As always, the United Way number in New York State hotline. Again, thank you, Infant Care, for what you're doing for the last 15 years, and for that awesome smile, and continue to do great stuff in your neighborhood.